will discuss about the middle ear anatomy. So for that I have made this box. So middle ear is assumed just a cuboid box. So it has 6 walls. The roof. This is the roof. This is the floor. This is the lateral wall. This is the medial wall. This is the medial wall. This is the lateral wall. This is the roof, floor. This is the anterior wall. This is the posterior wall. So from this we can find that this is the right middle ear cavity. So coming to the roof is basically formed by the tegmen tympani. So this is the roof. So this is tegmen tympani. So tegmen tympani is just a plate. It is a plate which contributes the anterior slant of the petrous part of the temporal bone. So it divides the middle ear cavity from the middle cranial fossa, and the middle cranial fossa, there lies the cerebral hemisphere. That means it is this cerebral hemisphere is what? This cerebral hemisphere is the temporal lobe. So this forms the roof. So this is the roof. This is the roof. Now coming to floor. The floor is basically formed by the jugular bulb. This is the internal jugular vein. The internal jugular vein forms the jugular bulb, and there is also a thin bone which separates the jugular bulb from the middle ear cavity. Along with the 9th and 10th cranial nerves are also present. So this is all about the floor. This is the floor and this is the roof. Now coming to the lateral wall. In the lateral wall we can find that there is the tympanic membrane. In the lateral wall there is a tympanic membrane below and the scutum above. So this is the scutum. This is the scutum above and the tympanic membrane below. The tympanic membrane, the scutum is the part above the pars flaccida, forming the lateral wall of the attic. So this is the attic. This is the attic. So lateral wall of the attic and the pars flaccida forms the scutum. So this is the scutum. This is the scutum. So tympanic membrane and the scutum together forms the lateral wall. And now from the tympanic membrane we can find that the bones, the ear ossicles like hammer, anvil, stirrup or the malleus incus are attached. Malleus is attached with the tympanic membrane, and we can also see that the incus long process through the tympanic membrane and the cauda tympani nerve. This is the cauda tympani nerve. Now coming to the anterior wall. The anterior wall is divided from the internal carotid artery by a plate. So this is the internal carotid artery. Now this is the anterior wall, and here we can see that there is one opening. This is the opening. This is the pharyngotympanic tube. The pharyngotympanic or eustachian tube opening to the middle ear is the anterior wall, is in the anterior wall. So there is also some collection of fat known as Ostman's fat pad which is present. The fibrocartilaginous part of the tympanic tube, nasopharyngeal opening. The fibrocartilaginous nasopharyngeal opening is present in 1.25 cm behind the inferior turbinate, posterior end of the inferior turbinate. So from the eustachian tube, this eustachian tube has a tympanic part and a pharyngeal part. So it opens into the nasopharynx, the lateral wall of the nasopharynx, 1.25 cm behind and below the posterior end of the inferior turbinate. So it maintains the ear equilibrium, the pressure equilibrium. Okay, and the length of the eustachian tube is 36 mm. The 12 mm is the bony and 24 mm is cartilaginous. The bony cartilaginous junction is the isthmus. It is at an angle of 45 degree. It is an angle of 45 degree. Now there is another opening where the tensor tympani muscles is attached. The tensor tympani muscle is attached. It originates from the canal of the anterior wall of the middle ear, and it winds around the processus cochleariformis, which is present in the medial wall, and then it attached to the handle of the malleus. So tensor tympani ultimately attached to the handle of the malleus. This is the handle of the malleus. This is the handle of the malleus. So it tenses the tympanic membrane and dampens the sound. It tenses the tympanic membrane and dampens the sound. So this is the tensor tympani muscle, which winds around the processus cochleariformis in the medial wall, and then it tenses the handle of the malleus. So it is attached in the handle of the malleus. It is originated from the anterior wall. It is attached from the handle of the malleus. There is also petrotympanic fissure, and the canal of Hoogier. The canal of Hoogier is the exit side of chorda tympani. This chorda tympani nerve exit from the anterior wall through the canal of Hoogier. So there is a canal of Hoogier here. There is a canal of Hoogier. Now coming to the medial wall. In the medial wall, we can find that there is a promontory. This is the promontory. This is the promontory, which is a bulging center where the basal turn of the cochlea is present. So from here the basal turn of the cochlea arises. There is a processus cochleariformis, which is not present here. There is a processus cochleariformis where the tensor tympani muscles wind around medially and gets attached to the handle of the malleus. There is also one importance for the cochleariformis because it is the first genu. It is a landmark for the first genu of the facial nerve. Now there is a semicircular canal. There is also a lateral semicircular canal. The facial canal is present, and there is a oval window and a round window. The oval window and a round window. The oval window lies posterior superiorly because it is the posterior part, so it is lie posterior superiorly, and the round window lies posterior inferiorly of the medial wall. In the round window there is a secondary tympanic membrane. It is attached, and it is separate the middle ear from the scala tympani of the cochlea. It separates the middle ear from the middle ear cavity from the scala tympani of the cochlea. And what is the significance of the round window? Oval window. Oval window. In the oval window there is a bulging of the lateral semicircular canal, and also the tympanic segment of the facial nerves rise. This is the tympanic segment of the facial nerve which lies horizontally in the posterior direction of the medial wall between the lateral semicircular canal and the oval window. So there is a lateral semicircular canal bulge, and in between the lateral semicircular canal bulge and the oval window there lies the horizontal part of the tympanic membrane, the horizontal part of the facial nerve. So